share their experiences to influence the solutions, regulations, and the improvement of nutritional care at the EU, or it could be also at the national level. So feel free to, once you will be filling that question, yes, just a second. I just wanted to point out that the need of the group, which was mentioned by the Karin, it's so important to make it more sustainable. Also, taking into the account what Marco has said, it could not be just a single patient voices from conference to conference, but we need to build some kind of reference group which you can count on, which you can refer to on a daily basis, also between the projects. And that's why it's so important to keep it going, and also to ask you to help us to move this forward and to engage more and more patients. So yeah, just to, I won't be able to give you the examples, but yeah, the only Facebook patient groups, there is majority of answers no, but EUPATI is also another. So that's the point. We are really a unique platform to address the nutritional issues, and that's why I believe that's a good point to develop this. We asked you before about the survey, and I highly appreciate, we all highly appreciate your feedback. There were more than 10 answers. What kind of obstacles do you notice when it comes to the delegations? Why the patients are not so inclusive and cannot come to the conference? And that's the quote which I really would like to point out, because it really shows the very important aspect why the clinicians bring a systematic expertise, but the patients can bring the reality of living with malnutrition, living with that kind of problem. They can really, in a best way, bridge the gap between the clinical theory, ensuring that the discussion, also here the discussion, will be human-centric, will bring the human-centric outcomes, that will be really address the points and the problems on our daily basis, and we can quickly identify all the not clinical barriers as well. But of course, that's the challenge, that we have a great discussion during such a meetings like today. Really nice ideas, and that's a sign of the life. May, it was the last year conference, this time is June. Then there are some signs of the contacts in between, but definitely the goal which we wanted to achieve is the fact that it will be continuous pools of engagement of the patients, and that's why some actions needs to be taken, and the ideas. So the another, maybe I don't like to create the problems. I prefer much more to find the solutions. Nevertheless, the diverse ecosystem of the patients, that we need to address the problems at the different stages or different points in the patient's continuum of care, that it's prevention, it's all the healthy food, also the agriculture topics, obesity prevention. Then we have a patients from acute phase when the nutrition is needed for a short term. There is the disease specific, then the long term, like myself, when I need the home parental nutrition for a long terms. And finally, some kind of future actions and things which will shape the policy in the future. So these are all the problems which somehow needs to be covered by such a group. So definitely that's the challenge, but that's also a value of such a group, that we can approach the problem from a different perspective. It creates the solutions which can answer of the patient needs at the different points at this continuum of care. So coming back to some kind of summary from the survey which we provided, definitely the financial hurdles were the one of the points which you point out, or you mentioned lack of dedicated funding, ad hoc travel cost, I will refer to this afterwards. There was also an issue when it comes to the compliance rule and cooperation among the patients and the MNI, and the involvement of the cooperation with the patients. The other thing was that the patients may be not very clear about their roles. What will be their capacity, what will be the responsibilities. So definitely that's something what need to be cleared. And of course, coming back to the logistical realities, limited capacity time from patient representatives, that what was mentioned by Marco. I believe that coming back to the point that you are here, you are aware of this, but we really need to handle our, I mean, I don't want to start with the disease, nevertheless, the medical condition.